It's myself and my colleague Zoe that'll be talking on the webinar today. So we are essentially the Active Connections team. Active Connections is a programme of work funded by Herts County Council Public Health, all around embedding physical activity into healthcare. And you're going to find out a lot more about how we do that within today's webinar. We've been running this programme just over a year now, so we started January 2024, so we can kind of give a bit of an update on the progress we've done so far and kind of how the programme has developed, but we'll also be looking at ways you can engage going forward, and kind of the next steps with the Active Connections area of work. So if we go on, then we'll get started with a bit of housekeeping. So we are in the webinar function, so you should remain muted. I think you're all on mute already, just for everyone's kind of viewing experience. Makes it easier for people to hear that way. We might, at the end, we'll have an opportunity for questions. So if you did want to come off at mute at that stage, there will be the opportunity to do so. Mentioning questions, we also have the Q&A function. I can see some of you already putting in the chat, and we definitely encourage you to use the chat function throughout the webinar. But if you have particular questions that you want to ask, please do put those in the Q&A function, and we can make sure any questions are covered in the Q&A section of the webinar. Just to mention as well, live captions are also available to those that need it through Teams. Got done a nice little screenshot of how you do that there. So it's on the three buttons to click more, down to language and speech, and then you can click on the live captions there. So that's just for those that need that accessibility function that is available. And this webinar will be recorded and distributed to those that register. So if you have any colleagues or people that may be interested in the content of this, please do feel free to pass that recording on. So kicking off, probably worth saying who we are first of all. So myself and Zoe are from the Herts Sport Physical Activity partnership, and our organised vision is more people, more active, more often. And that has been the organised vision since it was established in 2003, but how we do that now is very much more targeted than it was when we first were established as an organisation. We're now very much around tackling inequalities through physical activity. We're one of 43 active partnerships, part of the Active Partnership Network. So active partnerships exist around the country, and we're the Active Partnership for Hertfordshire. And we're one of 43, as I say, within that network. We also work with a wide range of stakeholders, partners and organisations. So a lot of the work we're talking about today is kind of health system partners, but we also have other teams within the partnership, such as children and young people teams that work closely with county council and physical activity delivering providers around holiday activity and food programmes. We also work closely with all our local authorities, and they are actually one of our core funders alongside Sport England. So essentially we are funded by Sport England to deliver their strategy at a localised level, but with a bit more of a bit of discretion on how we do that based on the local needs. We're based at the University of Hertfordshire, and although we're based there, we're very much community focused. So it's more like an office space and kind of HR functions, those kind of things, but we're more kind of around using physical activity within our communities. And we've got around 35 members of staff and have a board that oversees the organisation's work. Just looking at our strategic objectives, so I said when we're talking about the partners that we have various elements of our work, but probably the big one that's most relevant for you attending today is that physical activity for health and wellbeing strategic objective. And Active Connections is very integral to everything we're doing with that. So kind of the strapline there, positioning movement, sport and physical activity at the heart about how we think about people's health and well-being in Hertfordshire. That's what we're trying to do. We're trying to work with the health sector to make physical activity seen as a really important intervention for supporting people's health and well-being. So Active Connections, that's what we're talking about today. I gave a bit of an introduction about what Active Connections is, but hopefully that will become clearer throughout the webinar. And in terms of what we'll be covering today, just kind of different elements of the Active Connections programme. So we're going to touch on the Active Practice Charter, which is for primary care networks and can either be GP surgeries or PCNs, but the principles of the active practice charter should be relevant for everyone. Although not all organisations can apply, the principles should be relevant for everyone on the call. Training opportunities that we either deliver or facilitate, both for clinical and non-clinical staff. Increasing staff wellbeing, using physical activity to support staff wellbeing, as well as that of patients. Also around increasing awareness of exercise referral schemes. Connecting to local physical activity providers is a big part of what we're doing through the Active Connections work, and we'll touch on that within this talk, and also around long-term health conditions. We know that people with long-term health conditions possibly have more barriers to being physically active, but they can actually benefit more than most. So what we can do to kind of tackle those barriers and get those with long-term health conditions being more physically active. And then we'll also talk about some of the digital resources that we've collated that are available for you to easily access.
Thank you, Tom. So we're just going to start off talking around the Active Practice Charter, which I guess it kind of ties in everything that we talk about around active connections. All of those areas that Tom's just mentioned on that previous slide, they all feed into the Active Practice Charter. And again, despite it kind of having a bit more relevance to some of the primary care based in the primary care networks, this can all be relevant to those in secondary care as well, and that's what we're hoping to reach out to everyone. So to give you a little overview of what the Active Practice Charter is, it's a certification produced by the Royal College of General Practitioners, and it's all around these 5 objectives. So reducing sedentary behaviour in patients and in staff, increasing physical activity in both patients and staff, and partnering with local physical activity providers. Now, when you apply to become an active practice, you can either apply as a primary care network or as specific surgeries. So sometimes we see people do this in a lot of different ways. So some people like to do this as just a surgery, really build it up with that one surgery and then go and get their whole PCN accredited. Other people like to apply as a whole PCN, and we've seen a lot of benefit in this. We also see people who get the status straight away and then kind of work with us more long term to embed that and really sustain that over the time. And we see other primary care networks who don't get the status straight away. They really, really work on embedding a lot of the initiatives, and then they get the status. So it kind of, there's lots of different ways to do it, but essentially the main point to note is that HSP are here, myself and Tom, to support you through that process. We've seen a lot of success so far. So you can see on the slide, we've the PCNs and surgeries that have achieved status. And even once you've achieved that status, we still continue to work with you beyond that, where you need, if there's kind of still gaps in those provisions in terms of the 5 objectives that you want to get covered. We've also got a lot of primary care networks who are working towards status. So the ones listed on the slide are like really, really close. In fact, some of them have now put in their application. But behind the scenes, we've got working with a lot more surgeries and PCNs, and they're just working a little longer to embed some of those initiatives. But we're spreading the word a lot across Hertfordshire, but hopefully this call as well. I can already see a few people in the chat who we haven't necessarily reached out to, and that's brilliant. And we hope to connect further beyond this webinar as well to really get this status embedded. So what kind of support can we give you in terms of that application? We should say first, the application process is really nice and quick and simple. You actually only need to be doing one thing in each of those 5 objectives. Obviously, we'd love to encourage more of that, but if you want to get one thing in each of those 5 areas and apply for that status, get the status and certification, and then we can work with you more long term to get so many more things embedded into your surgeries, then that's brilliant. So we like to look at what you're already doing. And as we move on to what some of those initiatives look like, I'm sure that a lot of them you'll go, oh, we're already doing that already. And that's already a nice quick tick box. But then we like to fill in those gaps. And the document that you can see on the slide is something that we've been using with a lot of PCNs just to highlight what they're doing already. In another colour, we can say, here's a great suggestion of something you can do in that area. If you need help connecting to some of those physical activity providers, we can support you with that. We can also highlight a lot of the good practice that's happening with other active practices, and we love to shout about these on our news articles and case studies on our website. And if that's something that you'd like support with as well in terms of shouting about some of the great work you're doing, we can definitely support you with that. And then yeah, if you need support within that application, just get in touch and we can help you through that. So we're just going to touch now on breaking down those initiatives, breaking down the 5 objectives and demonstrating specifically how you can do this. So we'll start with staff physical activity and specifically on reducing sedentary behaviour. You'll see a lot of these overlap as well. There's things that can replicate in multiple objectives. So yeah, don't let that put you off. So how do I reduce sedentary behaviour in staff? So it might be simple things like introducing some walking or standing meetings. It might be around disabling that patient call-in system, so going to the waiting room yourself and greeting those patients. It might be installing standing desks. So, you know, some of those might take a little bit more or to get some funding available. I'll touch on an opportunity in a moment where you might have the opportunity to win some of these prizes and embed them into your surgeries, but we'll get to that. So it might be appointing a wellbeing team for your practice to really promote that positive staff wellbeing. And I know that something spoken a lot about within healthcare is that QOF, which promotes a lot of staff wellbeing. So loads of this stuff can feed into that and hopefully benefit your surgeries. It might be organising a training session on the benefits of physical activity. So as well as that eventually being able to support your patients, I think a lot of the time it starts with your staff. If that member of staff is being more physically active themselves and really enjoying that and feeling more confident, they're going to naturally feel more comfortable talking to their patients about it and helping to refer them to physical activity in the local community. And we can support with this. So whether that's in your protected learning times, we might like to come along and either bring in a provider to help deliver some physical activity to your staff, or it might be delivering the specific training, and Tom will touch on that later. And then other nice ideas, because we know how busy your days are and we know how sedentary they can be, is, you know, in putting something like a poster in your staff room. It might be next to the kettle, so while you're waiting for the kettle to boil, it might just give you that little nudge to do a few stretches or some nice simple movement patterns while you're waiting for things like that. Or it might be just giving you that nudge that if you're on the phone, you might be able to do a little walk and talk. So hopefully that gives you a few little ideas to get you started. In terms of increasing physical activity for staff, it might be around setting up a cycle to work scheme, installing some of those bike racks outside your surgery. And again, that's where I say you might already have bike racks outside your surgery, and already that's a tick box. It might be around having a monthly competition for the most active staff. And I know one PCN that we've been in touch with they did something in December for part of their advent in the lead up to Christmas, and they did like a little movement advent calendar for all their staff to get involved in. I think it's really nice as well when you've got a champion within your surgery that really champions this active practice message. And it might be that they have a way of getting a message out to all staff to give them a bit of permission to, you know, a reminder to take those little movement breaks. And sometimes we did speak to one PCN who said, if that was somebody with more authority, whether it was a practice manager, a clinical director, that could send that message out and give that permission to staff, because I know you're all so busy and sometimes you feel like you need that permission to have that small break. Staff team building activities, and we're about to touch on this one in a minute. Just encouraging your team to get active, and it might be through the initiative that I'm about to mention, or it might be through those protected learning times, using those as a bit of teams staff building. Team building. You could speak to a local gym, your discounted rates for staff. You might also like to speak to an active travel expert, and we've done this with another local primary care network. who are embedding lots of active travel initiatives, which ultimately benefit both the staff and patients. So that might be more of a long-term thing that's not quite your tick box. So moving on, I've mentioned on this slide just around that the Active Hub, and this is an initiative which we launched at our Active Connections conference in December. It was brilliant. We had a really nice cohort from the health sector across Hertfordshire. We had representation from well over half of the PCNs in Hertfordshire, which is fantastic, seeing as how busy you all are, that you could still make time to come. And we highlighted a lot of the areas of our Active Connections programme. But we did launch the Active Connections Hub, which is in partnership with Total Active Hub, who produce lots of movement programs and platforms across, with corporates, with organisations. And this specifically is open to all staff from a primary care network across Hertfordshire. Now, what does this mean? What is a movement programme? So it's a way that PCN staff can track and upload their movement. We encourage general movement, anything. Somebody could be running a marathon, somebody could be doing 10 minutes of yoga, and it all counts. And that's the message. We want it to be as inclusive as possible. The hub includes various challenges where staff can compete against within their own surgery, but also against other surgeries and other PCNs. And it's nice, you get lots of, I want to say friendly competition. I don't know how friendly it always is. There's incentives and prizes to win along the way. So one of the challenges that we ran, it started on Blue Monday and it ran for 4 weeks, called Remove the Blues. This encouraged 20 minutes of activity every day across those 4 weeks. You had little nudges and incentives. So we joined the challenge as a bit of a tester as well. And I should say we're running this as part of a pilot, and we're hoping to get this funded beyond that pilot as well. So the more staff that we get on board on the hub, the better. We've already got well over 300 representatives of staff from PCNs on the hub. So we're looking really strong at the moment. So keep getting your staff on board. So the Remove the Blues challenge, we had loads of different prizes being awarded. So you join as a team. It's a team of 4, but you can have as many teams of 4 across your PCN as you like. And any activity is allowed. You can manually upload your activities. You can sync them to your watch, whether it's your Strava or etc. But there's also an app that you can use, and you can track activities directly from that app as well. So again, as I say, it's just making it as inclusive as possible for anyone to use. You can see on the slide as well just what the hub looks like. So there's nice places where when you upload your activity, you can pop a nice picture, so it makes it really nice space to explore. You can see people's activities on there. You can see a nice leaderboard as well if you when you take part in some of those challenges. You can see a bit of an overview of Active Connections and the wider offers that we have. But overall, we really hope that this increases physical activity of staff, increases that well-being element. And then, as I say, when you're being more active yourself, it's much easier to then influence your patients. Moving on to Tom.
Thank you, Zoe. So when we were looking at the Active Connections programme, we thought training around physical activity was really important, because we want to make sure that staff are confident talking about physical activity and referring patients to that. For some people, this will come naturally. They might be active themselves or might have had previous training around this, but we wanted to make sure across the board, healthcare professionals in Hertfordshire kind of do have a bit more confidence and do have the training to help deliver that. And there's various training methods we're using to support the sector be more confident around physical activity. So some of the ways we've been doing it so far. So within primary care, as we touched on, we've primarily been engaged with primary care so far within Active Connections, and we've been attending protected learning time. So within protected learning time, actually what we deliver can be tailored to suit that PCN or the surgery that we attend. And that has varied quite a lot across the board. So for one PCN, we attended all 3 hours of their protected learning time and had a focus on physical activity. And that enabled us to deliver active medicine, which I'll talk about a bit later. Also a workshop around active practice charter, getting staff involved in the active practice charter, which was really engaging and helped get buy-in from staff. Whereas other times we've also brought in local activity providers. So if staff might be unaware of services that are available locally, we can talk about that ourselves, or we can connect with those providers and bring them in to talk about what their service is and how the professionals can connect with them. And on the side there, that gives an example of some of the PCNs we've engaged with so far, but absolutely looking to engage with more over the next year and kind of roll this out further. So in terms of the active medicine, so this is one of the trainings that can be delivered by myself and Zoe or colleagues at the Herts Sport and Physical Activity Partnership. So this was actually designed by Get Berkshire Active, which is one of the 43 active partnerships, the active partnership for Berkshire, and it was funded by Sport England around COVID time, basically designed to support healthcare professionals around the things we talked about, learning around the benefits of physical activity, outlining the guidelines, giving practical tips and overcoming barriers, as well as including local signposting. And as I say, myself and Zoe can deliver this, and it's available for both clinical and non-clinical roles. And the beauty of this is it can be done to suit you and your staff. So whether it's attended a protected learning time, coming and delivering that in person, or if you wanted that online, we can also do that. It gives us a bit of flexibility as it's delivered by us at the partnership. And so far, we've delivered that to 272 members of staff, but kind of looking to roll that out further over the coming year as well. An alternative training offer that we've been providing and will continue to provide is PAC, so Physical Activity Clinical Champion Training. So unlike active medicine, this is peer-to-peer training. So our regional PAC trainer is actually a practicing GP. So she's based in Suffolk and she's a practicing GP, but she's got a passion in lifestyle medicine and really values the importance of physical activity for the treatment and management of her patients. The traditional PAC was all around prevention and management of long-term health conditions, and that's the one primarily we've run over the last year. But now they're looking at different alternatives of this, kind of offering more bespoke PAC sessions, so there might be more opportunities for that. Currently, this is typically delivered online, and we can open cohorts, so any healthcare professionals can sign up to a PAC to attend themselves. But if you did want a session tailored for a particular group, that is possible. We're happy to have a conversation, so yeah, just reach out and we can see what can be designed around that, but it's more likely to be online just because our trainer is based in Suffolk. There's some of the stats about the PAC that we run over the last year, but as I said, they're looking at new sessions. Our most recent one was actually around physical activity for the management of mental health conditions, and I think there's going to be six or so new sessions over the next year, and we've already got our next session arranged Tuesday the 6th of May, which I think we can include details of when we circulate the recording and slide to anyone, just in case anyone was interested in attending our next PAC training session.
Awesome. So we're going to move on now to patient physical activity, and see what kind of initiatives you can embed into your surgeries for patients around reducing sedentary behaviour and increasing physical activity as part of that active practice status. So how do I reduce sedentary behaviour in patients? So we can show some exercise advice, seated exercises, for example, on the screens in your waiting rooms. We can share some of these out if you'd like. We created a set of slides which just give you that little nudge to your patients to either make them thinking about some simple stretching routines and the benefits that can have. But it might also be around, the benefits of physical activity for if you've got a long-term health condition. And we've also got our activity finder slides that we can promote on those screens as well. So if you want any of those, again, we can help you with those resources and make them available. Other ways that you might reduce that sedentary behaviour is those little nudges for active travel use. So this might be that when you send out the letters, whether that's digital or not, for your patients for their appointments, it might be just having a little note on the bottom to say how they can use active travel to get to their appointment, a nice safe travel plan. Then we've got Moving More Activity Finder, which Tom's going to touch on in a minute, all around how you can find those activities locally and how you can promote those to your patients. It might be around using your personalised care team to help advise on what they can do in terms of physical activity. We've got a page actually on our Moving More Tom's going to touch on in a minute. The Moving More Activity Finder it's much more than that activity finder, and we've got some pages specifically for healthcare professionals. So if that's finding some exercise advice for somebody with a specific long-term health condition, it might be around that. So if that's something that whether you're in a clinical role or non-clinical role and you'd like to find out a bit more about that, we can pinpoint those pages to you, and then you'll be able to advise your patients a little bit better and more confidently if that's something you'd like. And then we've just got some of those quick tick boxes that I mentioned around. It might be just signposting the stairs more clearly for those that can use, and over using the lift, for example. And then increasing physical activity of patients. So again, signposting, there's lots of overlap on here, but signposting to some of those local physical activity sessions, and we can help you to connect to those. Sending exercise advice to some of those targeted groups and with those certain long-term health conditions. It might be adding the Moving More iframe to your website. Again, Tom's going to touch on this, but just making it a little bit more of a visual thing for your patients so they can find it easier and it's not hard to find, because as soon as it becomes a little bit hard to find, then they're not motivated to go and look for it. We're doing a lot of work around some apps as well, and just promoting some of those physical activity apps and the reliable ones, and how to find the right app for you. So again, if that's something that we can help you with, but just remembering that some of those apps are out there, even if it's a Couch to 5K or the Active 10 app, they're really, really good, beneficial ones to promote to. It might be becoming a parkrun practice, and I've got a slide on this, a couple of slides ahead, in terms of how to become a parkrun practice and what that really means. But this is a great one to just connect with your local parkrun, promote it to both your staff and your patients as a way of getting involved. Being more aware of the local blue and green spaces. So again, it might be, again, with that personalised care team, to just understand what is around locally, promoting to those where possible, and getting out and being active. When we talk about physical activity, we're not always talking about sport. It's just being outside in the open, and just finding some way of movement that suits you. And then it might be connecting with some of our active aging offers. So it's not something that we've touched on massively within this webinar today, but we do have our Live Longer Better in Hertfordshire movement, which is all around, it's never too late to get active. It's not just specifically older adults, but we're just looking at active aging, what you can do to help really, really strengthen and prevent some of those things that decline as you get older, and using physical activity for that. So if that's something you'd like to connect with more, and we've seen some PCNs connect brilliantly to this movement, then we can again connect you to that. So ideas of partnering with that local physical activity provider. Again, might be becoming a parkrun practice. It might be teaming up with Hertfordshire Health Walks. We've seen some PCNs have some of their personalised care team train as health walk leaders, put on a new walk that goes around their surgery. They can get their staff out on that, they can get their patients out on that, and it helps even more so because you've got some of those roles there who can talk to patients about their conditions as you're going on some brilliant exercise. So that's a really nice one to get involved in. It might be connecting with your leisure centre to connect to your local exercise referral scheme, and just bringing a little bit more of awareness around that. Again, speaking to your local gym around discounted rates, whether that's for staff or patients. It might be connecting to other local physical activity classes, just some of those that are more niche to the areas that you're in. And again, you can use our activity finder to find some of those if you're unsure where to start. I've already mentioned about Live Longer Better in Hertfordshire. And then ultimately, you can collaborate with your local active partnership. So that is us, that's connecting with myself and Tom, and using us where possible to connect to those other physical activity opportunities. So when it says local provider, it doesn't necessarily mean a provider. It can be anyone connecting to that physical activity cohort. So don't forget that. So just to touch on a tiny bit more around that parkrun practice, you'll be able to find a map online of all those parkrun practices going on, as well as where your local parkruns are. Don't forget that there is not only the adult parkrun that happens on a Saturday morning, but there's also junior parkrun, which is another great one to refer to, that happens on a Sunday morning. You'll be able to find a GP partner toolkit just explaining how you become a parkrun practice. It's not a huge, it sounds like a huge thing to undertake, but it's essentially just a way of connecting and a way of not an official referral, but a way of just encouraging your patients and your staff to get to the parkrun. And it might be that some of the staff within your PCN just have a bit of presence at that parkrun, whether you're spectating, whether you're volunteering, whether you're running, jogging, walking, anyway. But yeah, the whole process isn't too time consuming, and you'll be able to use the toolkit when we share these slides out afterwards, just to have a little look at that in more detail to know how to take part. And it might be that you qualified as a parkrun practice years ago, and it's gone off your radar a little bit. So it might be just bringing that more into the forefront and knowing how to use that. So I just pass on back to Tom to talk more around that activity finder.
Thank you, Zoe. Yeah, Zoe teased a little bit around moving more, but yeah, I can talk about that a bit more. If I go on to the next slide, please. So moving more is actually a collaboration between ourselves, Herts County Council, and Herts 1 GP Federation. And although it's driven by us, we really want it to be seen as the Hertfordshire's moving more activity finder. So it's for everyone to use and benefit from. And there's three main outcomes from the activity finder within moving more. It's for residents and those working with them to improve awareness and access to physical activity opportunities. So we see it as a valuable tool for anyone who wants to be physically active. But primarily in terms of this work, it's for those that might not be aware of activities around them. So giving them a tool to find activities, but also for healthcare professionals or those working in personalised care to help work with patients to have discussions and look and find activities that may suit them, or kind of giving them referring on and saying, have you had a look at moving more to find local activities? Also for providers, so we want to support providers to raise awareness of their opportunities, and then just generally for everyone. The beauty of moving more is that it uses open data, not to overcomplicate things with what that involves, but it essentially means that the information never goes out of date, because we're relying on providers keeping their information up to date. So it's not someone goes on and puts the session information on a static platform. They will have a booking system, or they can use a platform called Open Sessions. And essentially the Moving More Activity Finder pulls that all through into one place. We always use the unhealthy analogy. We really need to change it, to be honest, particularly when we're talking to healthcare professionals. But it's like your Uber Eats or Just Eat. So you have all your large kind of fast food restaurants. So you might have your McDonald's, but it also has your local fish and chips on there as well. So it makes sure on Moving More, the equivalent is we have our large leisure providers. So you have your Everyone Actives, kind of your big leisure centres, but you also have your local gym instructor, and it puts them all on an even platform so people can find an activity that's most suitable for their needs. We do really need to stop using that analogy there. In terms of what Moving More looks like, so this is the page. So you can search by different factors, again, kind of making it really user-friendly and easy to find activities. So you can search by location, and you can kind of filter out within whether it's a 5 kilometre radius, 1 kilometre radius, or if someone's willing to travel a bit further. What's really good is the accessibility function. So under that, you can filter out activities that have kind of ticked that they're appropriate for different impairment types. So that might be mental health condition, that could be physical kind of disabilities and things like that. Again, just helps people filter and find activities that suits their needs. In terms of the wider Moving More, So the activity finder we've spoken about already, but Zoe mentioned we got a lot more within that moving more activity find, moving more website, sorry, than just the activity finder. So we got a moving more at home. So we've collected resources to support people to be active within their home, and that's filtered out by different criteria. So those with long-term health conditions and disabilities, we pull together activities that are suitable for those that can be done as a family, so kind of those that are more appropriate for children, as well as kind of encouraging ways that people can be active outside in nature as well. We also have information for professionals. Again, I think Zoe touched on this a little bit, but we've pulled together a lot of resources. So when professionals are talking to patients around physical activity, they can go on there and use these resources to help signpost. So that's both national and local. So it's a lot of the things we talked about today. So it's your Hertfordshire health walks, park runs, but it's all in one place, hopefully making it easier to know where to go to find all of that information. At that bottom of that resources page, there's also around condition specific insights. So those have been produced by kind of charities, so Macmillan for Cancer, and it just provides a bit of guidance around conditions and how to be active with certain conditions. So we pulled that all together in one place, hopefully making it easier for people, for yourselves to signpost and talk to people about physical activity. We're moving more stories, but a lot of that is around spotlighting good practice, and encouraging kind of shining a light on the providers that are engaging really well, particularly those that are reaching those that more of our target audience, those that might be facing harsher inequalities. And again, hopefully shining a bit of spotlight on them can inspire others to get involved in those activities. We have a web-based app, so when people go on the activity finder, they can download that so it stays on their phone. So rather than having to log in every time, they can use our web-based app to always be able to search for activities easily. And then finally is around the moving more widget and iframe, which I think we've got an example of on the next slide. So in terms of the ways that you could be moving more, using moving more, this is a good one around using the widget. So essentially what we got is an iframe that can go on your website. So it can go on any partner websites. So this has been on local authority websites, but it's also been on individual surgeries and PCN websites. And we just got simple information that can be sent to someone who does the web pages, and it just gets added. And you can see there, it means that patients can go onto your website and they're being made aware of physical activities, opportunities that are happening locally. And that they don't even have to leave your website. So if it's not of interest, they don't have to click on it, but it means they can search and find those activities easily. Other ways you can be using it is kind of signposting to moving more, using kind of referencing the activity finder and having that as a tool for you. Promoting moving more within your waiting rooms. So we've got a GP slide created for moving more. So if you wanted to add that to your waiting room slides, that can easily be done, and we can circulate that to anyone that's interested. Invite us to present. So within everything we've spoken about today, happy to present to either patients, staff, whatever is most appropriate, and we can include moving more within that. Or potentially also if you have any newsletters going or communication that goes out to patients, you might want to include information about moving more within that. And we've got a partner toolkit that has all the key messagings that can easily be lifted. And I think that's linked within these slides. So when these slides are circulated, you'll have access to that partner toolkit. But if there's any content that you would, if you were interested in including moving more in any publications, we can easily pull something together for you with that as well.
Great, so we're going to move on to just a little bit around staying connected. So just coming towards the end of the webinar, and hopefully we leave a nice amount of time at the end for some questions if you want to stay on. So in terms of staying connected, and just finding out a little bit more around our Active Connections programme and the wider works. We've got our Active Connections webpage, which off of that webpage, it will explain all around what the programme entails, how to connect, and also it will link out to a page around becoming an active practice. So all of the information that you need there, a link to our page for our training opportunities, a link to the page for our exercise referral schemes and how to better connect to those. So you'll find all of the information that you need on there. And we've also got a variety of different case studies. So whether that's highlights what we've done at other protected learning times, and how we've utilised that time with that PCN and the kind of partners that we've brought in. Whether that is highlighting the success of the Active Connections Hub and how the Remove the Blues challenge went, and you can get a little bit more of an insight on how that works. And we've also got a great case study on there from Hatfield PCN, who were one of the first of the active practices that we worked with, and they've done an extensive amount of work. We've also created a video that highlighted all of the work that they were doing. They did some great stuff with Hertfordshire Health Walks, and you'll be able to see all of that on there. And I just left a couple of quotes on here as well that just highlight. So we ran a steps challenge with Hatfield PCN initially, and the other quote is from a participant that took part in our Remove the Blues challenge. So it just highlights and brings to life the kind of work that Active Connections is doing, and the impact that it can have on staff, and then hopefully that infiltrates to the patients as well. So moving on, we've got our Healthcare Physical Activity Champions Network. It sounds more fancy than it is, and really it is a quarterly newsletter that you can sign up to get updates on all the kind of things that we've been talking about today and much more. So where I've mentioned things around Live Longer Better in Hertfordshire, we didn't have time today to talk about that, but there'll be lots of little nods to things like that and ways that you can better connect and embed physical activity into your surgeries within these newsletters. It might be around shouting about good practice and things that other surgeries and PCNs have been doing in Hertfordshire. It might be shouting about those that have just got that active practice status, but also, even if you have got that status, you can use this newsletter to find out other ways to continue to embed initiatives into your surgeries. It might be shouting about some of the training opportunities that we have coming up. So Tom mentioned around the PAC training or active medicine. If we're hosting one of those that's open to everyone within Hertfordshire, we'll shout about those in our newsletter. So yeah, if you're interested, if you feel like you want to be a bit of a champion for your surgery or your PCN, then sign up as a HPAC, that we call them, and you can receive that quarterly newsletter. And if there's anything in particular that you guys want to be featured in those newsletters, or kind of particular information that you feel like you don't have at the moment that you would like, again, do get in touch with us, and those are the sort of things that we can include within those newsletters. So what is next within our Active Connections programme? So we really want to build more active practices. We want to share that best practice. And again, remember that we like these case studies and the news articles. So do get in touch when there are really good things that you want us to shout about that you're doing. And we want to hear from you as well. So if there's particular support that you need, a bit like I just mentioned, then do get in touch with us, and we can kind of help you to connect, help to, even if that's a new area that we want to research and start to embed within our Active Connections programme, we really want to hear from you. Developing that active medicine training that Tom spoke about. So we're working on at the moment a bit of a longer version of that active medicine training. So it's 1 hour at the moment, but if we can get a longer version of that, which really embeds a lot of motivational interviewing and behaviour change techniques, that's something that we're working on a partnership to get out and rolling further on in the year. Growing the Active Connections Hub for another 12 months. So we're seeing great benefit of the Active Connections Hub at the moment and how much that's doing for staff wellbeing. And we'd really, really love to see this grow and get more people involved. So keep shouting about that to your PCNs and your surgeries, and just get as many people on there as possible. And hopefully we can really see the benefits. And don't forget, there's some great incentives to win as well on there. And then also running, so we ran our Active Connections conference in December, as I mentioned, and we'd really love to kind of run some smaller, maybe more localized versions of this to really increase those networking opportunities. As Tom mentioned, with the Moving More Activity Finder, you have those big leisure providers, but you also have your really local activity providers. So it might be just a local yoga class. If we do those more localized versions, you can really bring those partners together and hopefully try and find a way of embedding them into your surgery. And then we're really working at the moment on, we've kind of started very heavily with primary care, and we realise that there's this whole secondary care sector that we haven't really touched on yet. And hopefully there's some of you on the call as well that is from that sector that we can help to connect to. And we'd really love to shout about more of this work and embed some of our training opportunities within the secondary care sector as well. And finally, just to say, bring it back to the start. This is all around the active practice charter. We'll share these slides out, and we've got the sign up link here. You'll find it on the page for the Royal College of General Practitioners on their Physical Activity Hub. Remember, it's what you're doing currently and not what you're planning to do. So get in touch with us. We're here to help you, and we can put together that little document to see what you're already doing, what you could be doing, and then put you in a nice position to get that application in. So yeah, don't forget to use us for that as well. And then finally, a big thank you to everyone that's attended today. We've got our details on the screen, so if you do want to get in touch, and if anyone's got any questions, whether you want to come off mute or whether you want to pop them in the chat or the Q&A, we can stay on a little bit longer. We've finished a little bit ahead of schedule, so we can answer any questions that you would like.
We had one question earlier just around our next PAX training. We haven't quite set up the link for that yet. We're just waiting for confirmation around that session. It will be that day, but just finalising content. So as soon as that's confirmed, we can make sure that that's circulated to everyone on this call. And I would just encourage it, if there's anything within this call, however big or small, that you want to discuss further, then do reach out. Kind of, that's why we're here. We want to hear from you, and happy to connect in any way that you feel could support you or your service. We haven't got